At the AfriChild Center, we are passionate about improving the lives of children within humanitarian settings. We are therefore prioritizing research in refugee settings across Uganda and outside Uganda. With support from the Hilton Foundation, we are currently implementing a project strengthening research and evaluation capacity for evidence-driven policies and programs to improve child well-being in Africa, and specifically within refugee settings. This project is focused both here in Uganda and Ethiopia.
Refugee children experience unique challenges in the area of early childhood development due to displacement, trauma, but also due to inadequate access to services. This has an impact on their physical, cognitive, emotional, and even social development. And we recognize that despite the importance of early childhood development and the recognition that the global community and indeed the government of Uganda has given to early childhood development, services for children in refugee settings are not tailored to respond adequately to their needs. Services for early childhood development in refugee settings are pre-designed and do not take into account the unique cultural context and the realities of refugee children, do not take into account the resources of refugee children and the knowledges of the refugee children. With the Straight Research project, we set out to address these challenges by designing a community-led intervention, a refugee community-led intervention that builds on the expertise, the knowledge, and the cultural resources of the refugee children and families themselves. We anchor our work in a two-generational approach to co-design an intervention that we think will be relevant in terms of scaling up, but also relevant in terms of adequately responding to the needs of children.
The unique approach, which is very important to talk about, is first and foremost starting from the context of the community to begin to explore things. And we are looking at this as one of the ways of decolonizing research and allowing bottom-up engagement on issues that affect communities. We had a very successful ethnodrama where from the baseline we were able to engage the community on how they could actually act some of the findings and again build further conversations on the issues that the communities have been able to interpret from the baseline. And we are continuing to have conversations on that to be able to move towards identifying what are the key issues that they know, that they think we can work with and work with them to address in the co-design as we move forward.
So far, the project has accomplished many milestones. We started with community engagement with a view to understanding the context, and we moved on to establishing community structures, including the Community Advisory Board, both in Ethiopia and in Uganda. And from there, we undertook formative studies, which included the political economy analysis of ECD in both countries. We did a mapping of scholars and refugee-led and community-based ECD interventions, and we also did a baseline to inform the co-design. And currently, we are undertaking a co-design in Uganda. The Ugandan team has already embarked on the co-design phase, The Ethiopian team is winding up with the formative studies, and they will soon embark on the co-design. So far we are in Nachivare refugee settlement, specifically in the Juru sub-base camp, where the co-design is happening.
In our experience so far in the field, we have learned that co-designing and working together with the refugee community is time intensive. It takes a lot of time to deconstruct the dependency that has accumulated in the mindset of the refugees for so many years, and assure the refugees that they can be at the forefront of determining their own destiny. So we've invested a lot of time in deconstructing the dependency and the lack of self-reliance to get the refugees to a point where they are beginning to believe that they can actually design something for themselves.
Now Tomorrow Uganda is a refugee-led organization operating in Nachivale refugee settlement for the last 5 years. As a refugee now for 20 years in Uganda, I find this as an opportunity to give back to the refugee community. Now, our partnership with the AfriChild Center has yet given us another opportunity to give back to the community that we serve. Now, having them on board, it gives us at least some ideas on how to research and find some evidence that can allow us to intervene in some issues that are affecting our children. Now, looking at our work so far, it gives more of community engagement approaches, workshops with the parents, trying to understand the issues around the ECD programming in the settlement, and this has been an opportunity.
Part of what I'm learning is also related to the importance of being patient while exploring issues the community is so familiar with. We need a good amount of time to reflect with the communities, to come back to the issues that have been raised, to present them, to discuss them, to validate them, which is very important in terms of giving us a way of working with what the community will have identified as the issue. So we see the importance of time, the importance of being at the speed, or working at the speed of the community, the importance of making sure that we follow the clues on almost everything that they raise that seems to be unique. So it is somehow demanding on our part to open up and to allow, free expression of issues, and to allow more time to follow on a few things that emerge from the discussions, from the conversations, especially using the local context, including language and naming of things that the community is familiar with.
Mu community nikora nka deputy wa C3 wa sub camp ya Juru, kasharamu nkore nka advisor aha kakiiko habw'obwire mu project ya stretch ninye webembera akakiiko kaza no mu training Kampala aho tuberere nitwiha ebyarugire mu research. Community yitu neyepenga byinji, hari akakiiko aka konka ebyinji nibateekateka obuyambi obw'okuheereza abaana baitu ebyokubayamba okubashomesa na munonga ebyokubayamba okukuragye, okukuragye, okuryagye, okujwaragye. Community yangye neeza kukwakira ebirungi ebya project egi.
And the challenges, of course, are high expectations from the refugee population, which is really not unique because almost everybody who works in the settlement faces this, given the high vulnerability.
What we feel this partnership can bring to us as a refugee-led organization, with the target of localization and all these agendas that the world is creating, is to focus on documenting our outcomes, our inputs, and all our experiences that we go through in the community, but also try to somehow strengthen our capacity and increase on our publicity. The AfriChild Center is very experienced in these areas, and we feel like this partnership can bring to us such a step to also move forward and be able to respond to the issues around early childhood development.
My observation about the enthusiasm of the communities that we have interacted with and have invited to work with us in the co-design of the intervention, and that is the communities in Uganda, in Achivale, and the communities in Bambasi in Ethiopia. Quite welcoming and interested in listening and being part of the process of establishing or identifying the key issues that constrain early childhood development work. I'm happy to mention that their enthusiasm really creates demand on our part as researchers. We are so much interested in listening to their voices, seeking guidance based on how they view things in their communities, in their settings, and interrogate further some of these issues, bring them back to them as feedback. We've done that in Achivale, and we are getting feedback which indicates to us, in fact, that these communities are very strong in terms of defining the issues that constrain the care and upbringing of children and meeting all the other aspects of ECD in their communities, in their settings.
Our milestone so far has been to start the co-design phase, where we have not only zeroed in on a particular village, Kabahinda, where the co-design proper is taking place, but also establishing another community structure, the co-design team in the village, which is working with the community advisory board in the larger sub-base camp of Juru to support us in the co-design.
In the session that we had with the Refugee Welfare Committee chairperson, he made reference to what had happened at the GRF 2023, where the refugees committed to self-reliance, and he acknowledged that the Stretch project is one of the few projects in the settlement that are actually pointing towards that direction. So that gives us confidence that the work that we're trying to do here, albeit experimental, is actually important and relevant work that could help to shape and redirect the way policies and programs for refugees are designed and developed.
The opportunities is a willing population, a population that is receptive, that is willing to work with researchers. That's one really the biggest opportunity. But we also, when we started our work, we discovered that there is in existence a refugee-led research association, which we have worked with in the formative studies and has been very supportive. We have also found another opportunity, the Nachivari ECD Consortium, key actors involved in ECD services, and these have community structures, refugee-led structures that have been very, very vital and are vital for the implementation of meaningful and context-relevant ECD. The other opportunity, of course, is the support from the Office of the Prime Minister to allow us access to the refugee settlement, without which would not have been able to get here and work freely. The next is our partnership with the Now and Tomorrow, which is helping us to continue our work in the settlement and support us technically in terms of mobilization and in terms of making sure that every actor is aligned to what we are doing. So that's a great opportunity as well.